Vitamin D is sometimes called the sunshine vitamin because it's produced in your skin in response to sunlight. It's a fat-soluble vitamin in a family of compounds that includes vitamins D1, D2, and D3. Your body produces vitamin D naturally when it's directly exposed to sunlight. You can also get it through certain foods and supplements to ensure adequate levels of the vitamin in your blood. Vitamin D has several important functions. Perhaps the most vital are regulating the absorption of calcium and phosphorus and facilitating normal immune system function. Getting a sufficient amount of vitamin D is important for normal growth and development of bones and teeth, as well as improved resistance against certain diseases. If your body doesn't get enough vitamin D, you're at risk of developing bone abnormalities such as soft bones, osteomalacia, or fragile bones, osteoporosis. Here are the most surprising benefits of vitamin D. Number 1. Vitamin D fights disease. In addition to its primary benefits, research suggests that vitamin D may also play a role in reducing a risk of multiple sclerosis, according to a 2006 study published in the Journal of the American Medical Association, decreasing a chance of developing heart disease, according to 2008 findings published in Circulation, helping to reduce your likelihood of developing the flu, according to 2010 research published in the American Journal of Clinical Nutrition. Number 2. Vitamin D reduces depression. Research has shown that vitamin D might play an important role in regulating mood and warding off depression. In one study, scientists found that people with depression who received vitamin D supplements noticed an improvement in the symptoms. In another study of people with fibromyalgia, researchers found vitamin D deficiency was more common in those who were also experiencing anxiety and depression. Number 3. Vitamin D boosts weight loss. Consider adding vitamin D supplements to your diet if you're trying to lose weight or prevent heart disease. You can find a great selection of vitamin D supplements on Amazon.com. In one study, people taking a daily calcium and vitamin D supplement were able to lose more weight than subjects taking a placebo supplement. The scientists said the extra calcium and vitamin D had an appetite-suppressing effect. In another study, overweight people who took a daily vitamin D supplement improved their heart disease risk markers. Beware of deficiency. Many factors can affect your ability to get sufficient amounts of vitamin D through the sun alone. These factors include being in an area with high pollution, using sunscreen, spending more time indoors, living in big cities where buildings block sunlight, having darker skin. These factors contribute to vitamin D deficiency in an increasing number of people. That's why it's important to get some of your vitamin D from sources besides sunlight. The symptoms of a vitamin D deficiency in adults include tiredness, aches and pains, and a general sense of not feeling well, severe bone or muscle pain or weakness that may cause difficulty climbing stairs or getting up from the floor or a low chair or cause you to walk with a waddling gait, stress fractures, especially in your legs, pelvis, and hips. Doctors can diagnose a vitamin D deficiency by performing a simple blood test. If you have a deficiency, your doctor may order x-rays to check the strength of your bones. If you are diagnosed with a vitamin D deficiency, your doctor will likely recommend you take daily vitamin D supplements. If you have a severe deficiency, they may instead recommend high-dose vitamin D tablets or liquids. You should also make sure to get vitamin D through sunlight and the foods you eat. Food sources of vitamin D. Few foods contain vitamin D naturally. Because of this, some foods are fortified. This means that vitamin D has been added. Foods that contain vitamin D include salmon, sardines, egg yolk, shrimp, milk, cereal, yogurt, orange juice. It can be hard to get enough vitamin D each day through sun exposure and food alone. So, taking vitamin D supplements can help. How much do you need? There has been some controversy over the amount of vitamin D needed for healthy functioning. Recent research indicates that you need more vitamin D than was once thought. Normal blood serum levels range from 50 to 100 micrograms per deciliter. Depending on your blood level, you may need more vitamin D. The Institute of Food and Agricultural Sciences reports new recommendations based on international units per day. IUs help experts determine recommended dose, toxicity, and deficiency levels for each person. One IU is not the same for each type of vitamin, and IU is determined by how much of a substance produces an effect in your body. The recommended IUs for vitamin D are children and teen 600, adults up to age 70, 600 adults over age 70, 800 pregnant or breastfeeding women, 600 IU.